This video presents the challenges and breastfeeding experiences of refugee mothers accessing and utilizing healthcare services in Saskatchewan, Canada. Dr. Sheila Harani and her team acknowledge the support of Jim Pattison Children's Hospital Foundation that funded this study. I am a refugee mother with a young child who is accessing and utilizing healthcare services in Saskatchewan, Canada. Let me share my journey and challenges that I face as a breastfeeding mother. The journey from home to hospital is not easy. I wish there were childcare support or babysitting facilities in my community or hospital. It is challenging to access healthcare settings. I don't have my own transportation, so I have to call an ambulance whenever I need it. Use of ambulance service requires a lot of time and money. In a healthcare setting, most of the time people don't understand my language. It is very frustrating for me. I appreciate the support of nurses and doctors, but I wish they were more interpreters so I can explain my healthcare needs more clearly. I wish in the healthcare setting there is no racism. The stress of racism affects my health and well-being. During the time of my hospitalization, I wish hospital had some culturally appropriate food for me. In the healthcare setting, many barriers are not supportive of my breastfeeding practices. I don't have much breastfeeding support from my social network. In healthcare settings, I often don't receive need-based breastfeeding education and guidance in my language. Instead of breastfeeding counseling, I often receive formula samples in the healthcare settings. Many a times my breastfeeding practices are not supported. In healthcare settings, many a times there is no privacy to breastfeed. I feel very uncomfortable breastfeeding in front of many people. I wish there was a breastfeeding room in the healthcare settings. Before COVID-19, nurses used to visit me at my home, but not anymore. This is my story and I am not alone in this journey. There are a lot of refugee mothers who face similar barriers. We need your support to sustain our breastfeeding practices.